Atrial flutter or atrial fibrillations are the most dangerous atrial arrhythmia leading to the life-threatening to patients. And coming to the etiology or causes of both atrial flutter and fibrillations: COPD, chronic heart failure, smoking, hypertension, and indeed myocardial infarctions. So these are the most common causes of atrial flutter or fibrillation leading to the multiple ectopic foci. So let us see what is multiple ectopic foci. So in normal situation, normal circumstances, the SA node, which is leading to the all conducting system of the heart, which has got normal activity, whereas in case of fibrillation or flutter of atrial arrhythmia, the multiple ectopic foci leads to the atrial arrhythmia, flutter or fibrillations. These are the differences between the normal or abnormal flutter or fibrillations. See, the main differences between the flutter and fibrillations: the rhythm is abnormal. Rate as well as rhythm in both cases are abnormal, no doubt. And the arrhythmia of atrial flutter is considered when the heart rate is up to the 350 beats per minute, whereas arrhythmia of heart rate or atrial arrhythmia lies between 300 to 500 beats per minute in case of atrial fibrillations. So the atrial flutter is having the regular F waves in the ECG, and whereas irregular F wave of ECG seen in the atrial fibrillation. This is the very characteristic feature between the atrial flutter and fibrillation, and the only F wave would give us some leads to differentiate between the atrial flutter and fibrillation. In fact, other different features too. So the atrial flutter is very less likely seen in the patients, whereas fibrillation is more likely seen in the patients. So the recurrent current is a main cause for the both atrial flutter as well as fibrillations. Multiple ectopic foci with recurrent currents. The rhythm of atria versus ventricle in the flutter lies 2:1 or above, whereas mostly irregular rhythm seen in the atrial fibrillations. And atrial flutter is regularly irregular in manner, whereas the ECG of atrial fibrillation is irregularly irregular. So these are the very common differentiating feature between the atrial flutter and atrial fibrillations. In both cases, the diastolic time decreases very significantly, and that decreases the ventricular filling rate or ventricular filling capacity, that leads to the decreasing end diastolic volume and decreasing the cardiac output, finally leads to the heart failure in both cases, atrial flutter as well as atrial fib of the atrial arrhythmia. And let us see what are the common differentiating the visual features between the atrial flutter as well as atrial fibrillations. So the atrial flutter, so typical sawtooth F waves can be seen in the ECG. The other hand, the variable multiple abnormal F waves can be seen in the atrial fibrillations. So this is the difference between the flutter and fibrillations. The F wave, multiple irregular F waves seen in the atrial fibrillations. And the RR interval of the ventricular rhythm can be identified by keeping one piece of paper and marking with any one rhythm of RR interval and compare with the subsequent rhythms. So we can identify the rhythms of the ventricle in the both cases, and the both ventricular rhythm found to be irregular in nature. And this is how we can identify the ECG, given ECG, basis on F wave, irregular F wave. F waves are not the waves which is coming from the SA node. These are the immature P waves from the multiple ectopic foci. These are the differences between the atrial fib or flutter.